This program is brought to you by Emory University.
A decision to transfer a patient back to the United States is made by people beyond the walls of Emory. We are approached whether we are able to accept a patient, and if we are able to, we will accept a patient and take care of them to the best of our ability, just like we would any patient here in the metro Atlanta area or beyond. So we do not provide any information about the patient, for instance, their condition or where they came from or the name of the patient, without the patient's express consent. That is protected information, and it falls under the bounds of a doctor-patient confidentiality, and we don't share that unless the patient wants us to. The team prepared for this patient just like we did for the first two patients that Emory received. The only difference between this time and last time is we incorporated the lessons we learned in taking care of those first two patients. We learned that Ebola patients can have electrolyte abnormalities or salt abnormalities in their blood. And while we closely monitored them with the first two patients, we know that this can happen. And so we're being extra careful in making sure that we don't see any of these abnormalities in this patient. Advanced supportive care when caring for an Ebola patient means monitoring the electrolytes or the salts in their blood and making sure they stay within the normal range. If they get out of the normal range, then taking corrective action to bring them back into the normal range. It also means making sure that the patient has an adequate fluid balance. So encouraging oral fluid intake if they're able to take things by mouth, or providing them with intravenous fluids if they're unable to take anything by mouth. The final aspect of care for Ebola viral disease is monitoring the so-called hemorrhagic part of this disease. And that means making sure that there are adequate supplies of the blood components, red cells, white cells, and platelets, and that the body has enough factors to stop bleeding if bleeding occurs. And that is primarily supportive care for Ebola viral disease. Nutrition is very important for any sick patient, but especially so for an Ebola patient. They need to maintain nutrition, and if they can't take adequate nutrition by mouth, then we may need to supplement nutrition with intravenous nutrition. It should not be more difficult to take care of this patient in the absence of Zmapp, which is in short supplies, my understanding, because the primary focus of caring for Ebola viral disease patients is supportive care. Experimental therapies are just that. They're experimental. They're not proven, and so we don't know whether there is a positive, negative, or neutral effect of these experimental therapies. We're using the same protective gear that we did on our first two patients, and this is in accordance with the CDC guidelines, which recommend at a minimum healthcare providers use standard contact precaution and droplet precaution, which would be a face mask and a shield to protect the mucous membranes of the eyes. If needed, the CDC endorses stepping that equipment up depending on what one might encounter when caring for a patient. We are using the same team of physicians and nurses to care for this patient that we used for the first two patients. Fatigue is a concern with any healthcare worker who may be asked to work long hours. We're being extra careful to make sure that our physicians and nurses are working hours which are in the normal scope of their duties so that fatigue does not become an issue. The team caring for the patients at Emory has become very close over the last month, and we care about one another. We care about one another's health, just like a family cares about its family members. And so because of that, out of an abundance of caution, we actually are monitoring all of the team members' health. So we ask about symptoms on a daily basis, we monitor temperatures, we make sure that people aren't getting fatigued by spending too much time in personal protective equipment, and that they're getting enough rest in between shifts. It's hard to say how long this patient or any patient will be in the hospital. It depends on any number of things that sometimes are unforeseen. We decide that a patient is fit for discharge and is safe to be back out in the public in consultation with our federal partners, primarily the CDC or the Centers for Disease Control and Prevention. We also use as a minimum guideline the World Health Organization standards for discharging a patient with Ebola viral disease, which is resolution of the symptoms and then no detectable virus in the blood of the patient.
The preceding program is copyrighted by Emory University.